Missouri State Health Laboratory. I'm Gail Vasterling, Director of the Missouri Department of Health and Senior Services, and I'd like to introduce Missouri Governor Jay Nixon. Thank you.
Good morning. Gail, and thank you for your commitment to public service and great leadership of the Missouri Department of Health and Senior Services on so many fronts. Your professionalism and your team helps keep people safe, helps take care of folks, and makes this a much better state. I want to thank everybody for joining us today. Protecting public health is a key responsibility of state government. The exceptionally skilled professionals at the Missouri Department of Health and Senior Services work year-round in collaboration with local and federal partners to prevent disease and to improve public health. Today, their role is more important than ever. With the outbreak of deadly Ebola virus in West Africa and isolated cases in Texas, here in Missouri we have been working methodically to ensure that we are fully prepared to protect the public in the event this disease finds its way to our state. That is why DHSS and the local public health agencies have been working with hospitals and medical providers from around our great state. Physicians and hospital staff have been provided 24/7 access to state and regional epidemiological staff through the DHSS hotline. In addition, beginning in July, DHSS disseminated 10 health alerts to health care and public health agencies regarding Ebola preparedness, identification, and treatment. Those alerts are included in the packet being distributed today. So members of the press, you want to see this kind of stuff that we have been proactively moving out through the healthcare agencies and providers in our state. Last week, the Missouri Department of Health, in conjunction with the State Emergency Management Agency and other state agencies, conducted a comprehensive preparedness training with more than 200 representatives of public health agencies, emergency medical services, hospitals, long-term care providers, law enforcement agencies, and schools. Training exercises are currently being planned, and additional education was provided to hospitals yesterday at the Missouri Hospital Association's statewide conference. Now, last year, I transferred the Center for Emergency Response and Terrorism from the Department of Health to the Department of Public Safety to improve the coordination, training, and response capabilities of our first responders should a public health emergency occur. And when it comes to threats to the public health, rapid, accurate testing and timely notification are vital. And that's what brings us to the state-of-the-art public health laboratory here today. Given the importance of rapid detection and response, earlier this month, I directed the Department of Health to seek the designation necessary to safely and accurately test for Ebola here in Missouri. Today, I'm announcing that Missouri's State Public Health Laboratory has earned this designation as an Ebola testing laboratory, further enhancing Missouri's preparedness should a case of Ebola occur in our state. Missouri is now one of approximately 20 other public health laboratories in the country prepared to conduct such tests. With this designation, the lab, when appropriate, may receive and test lab specimens as part of the coordinated effort to investigate and control this deadly disease. This is a positive step because when it comes to detecting infectious diseases, hours, sometimes even minutes, can be crucial. And the faster we can confirm or rule out a potential case of Ebola here in Missouri, the more effectively our health providers can respond to protect the public. This dedication is a testament to the fact that this laboratory is a nationally recognized leader in providing quick, safe, and accurate analysis. Since 1999, the Missouri State Public Health Laboratory has been a designated member of the CDC's Laboratory Response Network, whose members work collaboratively to prepare and respond to public health emergencies. A biocontainment laboratory that is home to some of the most highly trained scientists you'll find anywhere. This lab conducts over 6.5 million tests annually. The work here already saves lives each and every day. For example, through Missouri's newborn screening program, this lab helps to identify diseases quickly, allowing doctors to do early and often less invasive interventions to save or improve the lives of those newborns. This lab has received national awards from the Association of Public Health Laboratories and the CDC, and is consistently ranked in the top 10% for performance in emergency response drills. With an exceptional track record and an unwavering commitment to excellence, scientists and technicians here are uniquely qualified to perform these tests with the same level of dedication they bring to their work each and every day. This designation is another example of the practical, proactive approach to public health and safety that has served us well time and time again. Now, beyond the events of the last few weeks, there are many other challenges our frontline public health professionals have to confront each day, from the flu to foodborne illnesses. Throughout the year, and especially now during flu season, our local public health agencies provide essential services that keep their communities healthy and strong. That is why my administration is also today releasing $3.3 million to help local public health agencies carry out their responsibilities at the local level. Revenue is limited, but with more than 8,000 jobs added last month, it's clear that our economy is moving forward, and I'm pleased we're able to make these resources available. Our local public health agencies are vital partners in our efforts to protect and improve public health, and we appreciate their hard work on behalf of the Missourians they serve. And again, I want to thank Director Basterling and the team here at DHSS for their work. And with that, I'll be glad to take any questions that the press may have.